So we're going to talk about the nerves that come off of the spinal cord. And to first look at the spinal cord itself, when we have a cervical enlargement, which is going to be obviously further up above on this guy, right here, cervical enlargement. This area represents the brachial plexus that you can actually see turns into our lovely branches, roots, trunks. Help me out. Cords. Division.
Branches.
Cords.
Then branches.
Then
Randy
branches.
Travis drinks cold beer.
Yes. So Randy Travis drinks cold beer. And then we get into the lumbar region. So the lumbar also has an enlargement area, but then where this cone is right here, it's kind of like a V before it starts to flare out. That tip right there is known as the conus medullaris. Then it turns into like a horse's tail. Cauda equina is the horse's tail. If I were to follow one of these fibers all the way down, then this is known as the filum terminale. So we could see that the lumbar plexus and the sacral plexus eventually combine. One's going to go anterior to this nerve here, and that one, or excuse me, this one's representing posterior. And this one is the sciatic nerve, and then this one's representing anterior. How I know that is this one's following the bone or the actual femur, and that's the femoral nerve. So those are the two main structures that we look at on the lumbosacral region. So the other nerves that I have on here, this one here is known as the common peroneal nerve. Remember, peroneal is, it's not on the list?
I mean, it is, but you don't know
Fibula.
what goes on practically, so.
I do. So I like this one because when you cross your legs and the feeling of numbness is because of this nerve right here. So peroneal is also known as fibular. So you could write fibular nerve and that's fine. So
it
common.
connects with the knee.
Mm-hmm.
Okay.
And this is, just remember, that's the one that when you cross your legs, you feel numb on one of them, which is why I don't know why we do that. So we shouldn't feel numb. And these, the one that's going to the thumb is the radial nerve. The one that's in the middle that innervates digits 2 through 4, well, 2, 3, and a little bit of 4, is the median nerve. And this one is the ulnar nerve that just happens to do the medial side and the pinky and half of the 4th digit. So if you ever want to look at it there. But you should remember this from where the bones sit anyways, right? Lateral is rad, and that's the thumb side. Median is middle, and ulnar is on that side. Yes. And on this view, you could really nicely see the sciatic, which is always going to be appearing thicker than any other nerve in the body. And this is the femoral nerve. Those are the two options that you have down there.